Finding someone that understands you is hard because you're human, and there's a lot of different humans out there. eHarmony helps you find someone you can be yourself with. You think no one would understand mourning a plant like it's a loved one, or singing made-up songs to your dog, but that's the type of person eHarmony helps you find. Someone who makes you feel seen, heard, and understood. Get started today on eHarmony. Get who gets you.
So that guy I met on eHarmony, yeah, we're out together last night and I stepped off a curb and snap, heel breaks right off my shoe.
Oh no.
So I say, hell with it, take them off so I'm barefoot, and you'll never guess.
What?
He leans over, takes off his shoes and socks, and now we're both...
You're joking.
Amazing, right?
At eHarmony, you'll find someone you can be yourself with. Get who gets you on eHarmony. Sign up for eHarmony today.
Did you know that there's way more to the effects that estrogen has in your body than just the amount of estrogen that you have? Most people don't. You're listening to the Health Courage Collective podcast, episode 162, Understanding Estrogen Receptors Affects How You Age. Welcome to the Health Courage Collective podcast, the show for women who are too busy to slog through hours of generalized, inapplicable, and often contradictory health information, but too smart to ignore that a few minutes of focused attention now can prevent years of suffering in the future. I'm your host, Christina Hackett, a pharmacist who doesn't want you to live on prescriptions, a certified coach specifically trained to maximize your potential, and a compulsive learner obsessed with preventative, cutting-edge, holistic, and integrative medicine. I'm on a mission to increase your physical and mental resilience so you can fearlessly look forward to your next 40-plus limitless years. Your time is now. Let's go. Hello, and welcome to another episode. I'm so happy that you're here with me again today. I hope you are doing great. How's the rug underneath you? Has it been pulled out from under you? Or do you feel like you have some better options the next time that happens? I hope so. Today, we're going to talk about estrogen receptors. Whether we know yet what we want to do when our estrogen levels start to dramatically decline around the time of menopause or not, I think we all understand that estrogen plays an important part in our lives and in our health. We know that we don't want to have too little estrogen. Most women know that they also don't want to have too much. There's all kinds of conflicting and contradictory information about the inconceivable benefits of estrogen therapy and the inconceivable dangers of estrogen therapy. Believe me, I know it's inconceivable. You keep on using that word. I do not think it means what you think it means. But something I think most people, including medical professionals, don't think about is the effect of estrogen receptors on your long-term health. I believe understanding them will improve your future and make you smarter than most people, which are sometimes the same thing. So I know you know that estrogen is a hormone, which is a little chemical messenger sent out to produce various effects at target sites around the body. Estrogen, for example, helps maintain bone density and brain function and immune system function, and it can also increase the growth of breast and endometrial cancers. But the estrogen can't have any effect at all, anywhere at all, without an estrogen receptor to make that cellular change happen. Receptors are located both inside the cells and on the outside membranes of cells. Receptors are proteins in a certain shape, like a deadbolt, and the hormone is the only key that fits it. When a hormone is floating through your bloodstream or cell cytoplasm and sees an empty receptor, it connects. An empty receptor has one shape, and when the hormone docks there, it makes a new shape. A cascade of instructions is given to the cell as long as the receptor shape is in the full shape. Dr. Lindsay Berkson explains it like the shadow of two people hugging is a completely different shape than that of a single person or two single people standing a foot away from each other. We have 4 types of estrogen that we naturally produce, and there are at least 60 other estrogen-ish molecules that can dock into our estrogen receptors if they get into our bodies. I think we'll skip the info on the different estrogens we have for today, sadly, because I like talking about them. We can do that in the future, or you can take my Udemy class about bioidentical hormone replacement therapy. The non-biological estrogens, like the stuff found in environmental pollutants, in plastics, makeup, pesticides, and food additives, can fit into our receptor sites, but the shape it makes, so the shadow of the two people hugging, is just a little bit different than if one of your natural estrogens were in the receptor. When that shape is just a little bit off, it's not exactly what our body is made to receive instructions from, and the messages delivered can get a little bit off, or a little bit wonky. Also, the metabolism of those molecules is different when it's time for them to be cleared out of our bodies, and sometimes they can cause problems that way too. It's a mess because different chemicals affect different women in different ways. The results are wildly inconsistent, but never good, just sometimes less bad than others. These fake estrogeny molecules, like from organochlorides and petroleum products, etc., can actually damage the functioning of estrogen receptors. Just like it's vitally important to have proper levels of the proper hormones and the proper ratios to one another to be healthy, you need to have optimally functioning receptor sites in order for those hormones to get to your cellular machinery to do what the hormones are telling it to do. You also need to have the proper ratio of receptors. You want certain ratios of estrogen 3 and estrogen 2 and estrogen 1, and you want certain ratios of estrogen receptor alpha versus estrogen receptor beta versus G-coupled protein receptor 1. I wouldn't tell you about these if there weren't something that you could do about your receptor sites, but there is. When you woke up this morning, did you think you'd be embarking on a journey to change the ratio and functioning of receptor proteins in your cell membranes? You're so cool. Elwood Jensen first established the existence of estrogen receptors in 1958. In 1985, when I was in kindergarten, the first estrogen receptor alpha, was cloned. Then it took until I was in high school, 1996, for the next one, estrogen receptor beta, to be cloned. Then, not till 8 years after graduating with a doctorate degree in 2012, for G-protein coupled estrogen receptor 1 to be discovered. So that wasn't that long ago. I wouldn't be surprised if more are discovered in the future. There are also different isoforms or subtypes of each of those receptors. The reason why this matters to you is that the instructions to your cells from the docking of estrogen in different receptor subtypes is different. So if you have a lot of ER alpha and almost no functional ER beta, your results are going to be very different. Estrogen acts differently based on whether it's E1, E2, or E3, and also on the balance of concentration of functional estrogen receptor alpha versus functional estrogen receptor beta versus G-coupled protein receptor 1. It's the functionality of the receptors that ultimately dictates how estrogen will act in your body. Will it make you Wonder Woman, or will it promote cancer growth or blood clots? No matter how great your estrogen levels are, your body can't benefit from that unless you have functioning estrogen receptors in the proper ratios. So the body can get two drastically different results from the exact same hormone. ER alpha improves the response of bones to mechanical strain, which is a good thing. Straining yourself makes you stronger with the help of ER alpha. ER alpha signaling helps protect you from vascular disease and atherosclerotic lesions. It also decreases bacterial load in the kidney, which is fascinating, I think. ER alpha is abundantly present in the prefrontal cortex of your brain, and it helps prevent the loss of brain function, especially from neurodegenerative diseases like Alzheimer's, Parkinson's, and Huntington's. ER alpha is also a primary epidermal receptor, and ER alpha receptor expression is decreased in melanoma. Women are 30% more likely to survive melanoma than men up to the age of menopause. Then it's the same for both men and women. ER alpha generally promotes growth. It promotes cell growth in the breast, uterus, heart, brain, bones, intestines, blood vessel linings, almost every cell of the body. This is crucially important, especially for younger girls and women. ER alpha is primarily expressed in the uterus, ovaries, bone, white adipose tissue, kidneys, liver, and breast. In healthy breast tissue, ER alpha is expressed at a rate of 10%. I'm not sure exactly what that means. If that means that 10% of the cellular receptors are alpha, I don't actually know. But healthy breast tissue has a 10% expression rate, and the ER alpha expression rate in breast cancer is typically 50 to 80%. ER alpha expression is higher than ER beta in a healthy endometrium, but excess ER alpha promotes endometrial cancer development. So too much ER alpha increases chances of endometrial and breast cancer and growth of those cancers once they've started. Interestingly, ER alpha is crucial for the development of prostate cancer. It might also contribute to the growth of kidney cancer. It's that ER alpha growth signal. Things that increase your ER alpha signaling are excess body fat, stress, sugar consumption, refined carbohydrates, low quality fat consumption, having a poorly functioning thyroid gland, low progesterone levels, alcohol consumption, exposure to estrogenic environmental pollutants, vitamin B6 deficiency, and genetics. Most of the so-called estrogen dominance symptoms come from too much ER alpha activity, like endometriosis, ovarian cysts, PMS, endometrial, ovarian, and breast cancers. But too low ER alpha receptor activity can cause irregular menstrual bleeding, night sweats, weight gain, low energy, and mood swings. Estrogen receptor beta tends to do kind of the opposite, but not really. ER beta is primarily expressed in male reproductive organs, the central nervous system, cardiovascular system, lung, immune system, colon, and kidney. Overexpression of ER beta is not common, but it can facilitate the progression of endometriosis along with overexpression of ER alpha. But loss of ER beta promotes the progression of endometrial cancer. If you remember, ER alpha promotes prostate cancer growth, ER beta suppresses prostate cancer growth. While ER alpha is good for making bones get stronger in response to mechanical strain, ER beta actually suppresses that function a little bit, which doesn't seem good for cortical bone, but it promotes the strength of trabecular bone, which is super interesting. Cortical bone is what you usually think of as bones, especially long bones. Trabecular bone is found at the ends of long bones, and it's kind of a spongy and interspersed in the bone marrow compartment. ER beta might increase tumor cell growth in kidneys. Melanomas show decreased ER beta receptor expression. ER beta expression decreases by approximately 80% in breast cancer from normal levels. So most breast cancers, they've got this way overexpression of ER alpha, way under expression of ER beta. The absence of ER beta receptors results in a poor prognosis for women with breast cancer. ER beta improves lipid metabolism in the liver. This can be hugely important for lowering the lipid profile risk component of cardiovascular disease. Additionally, ER beta is predominantly expressed in human vascular smooth muscle. The reason women have much lower cardiovascular disease risk up until the time of menopause is that may be primarily because of the role of ER beta. ER beta inhibits the growth of atherosclerotic lesions that lead to angina and heart attacks. Functional ER beta receptors in vascular smooth muscle leads to drastically reduced risk of heart disease. One of the studies I read about this said, why estrogens enhance the proliferation of breast and uterine cells but inhibit the proliferation of vascular smooth muscle cells is an enigma, end quote. ER beta has also been shown to decrease artery calcification and reduce blood pressure in mice. While ER alpha is abundant in the prefrontal cortex of the brain, ER beta is widely distributed in the hippocampus, cerebral cortex, lateral septa, and medial and basolateral amygdala, pretty much all over the brain. Both ER alpha and beta are neuroprotective, and ER beta increases a very special form of brain miracle grow that you want called BDNF. Overall, while ER alpha does some good things but can start to get scary when it's dominant, ER beta keeps all that scary stuff in check. ER beta blocks excessive cell growth, preventing tumors from forming and growing. Healthy breasts have all three types of receptors, but more ER beta than alpha. The more ER beta signaling in the breast, the lower the chance of breast cancer. According to Dr. Lindsay Berkson, ER beta also helps vitamin D get absorbed into cells and boosts serotonin levels. GPER1 is a more recently discovered estrogen receptor, and we don't know quite as much about all the things it does yet. We know it's primarily expressed in skeletal muscle, neurons, vascular endothelium, immune cells, and organs that control autonomic activities like heart rate regulation, digestion, and perspiration. So, the overarching truth here is that you want a proper and optimal balance of all three estrogen receptor types. But many women have a decreased number and functionality of ER beta receptors, which can lead to the development of lots of different cancers, especially breast cancer, and cardiovascular disease and cognitive decline, including dementia. So focusing on increasing ER beta receptor functionality and quantity will put more years lived in good health in your future. We don't want only ER beta or to annihilate ER alpha, but we want to tip the balance more toward ER beta. So, how do we do that? Hey, I wanted to briefly interrupt to ask if you're curious about female bioidentical hormone replacement therapy, the kind that's usually started around the time of perimenopause. What it is, what it does, how it works, what it's like. If so, you should check out my Udemy course called The Basics of Female Bioidentical Hormone Replacement Therapy. The course goes over the pros and cons of using hormone treatment, which hormones are usually included with BHRT, how they're used, the lab tests that are used, some tips for finding a prescriber in pharmacy to work with, and how to develop a rough estimate of how much BHRT will cost you. If you've been wondering whether bioidentical hormone replacement therapy is right for you, it's time to close that open loop, stop wondering, and move forward with confidence. Enroll in my course today. As a listener of the podcast, you can get a special discount for the very best price. It's a no-brainer. I would just tell you the coupon code, but Udemy makes me change it every month. So check the show notes or go to www.healthcouragecollective.com/Udemy to find the special podcast listener discount code that's only for awesome people like you. Okay, back to the episode. That's the real point of this, right? I hope it's helpful for you to understand that estrogen isn't just estrogen. The way it behaves depends on the health and quantity of the different types of estrogen receptors that you're maintaining. But what really matters is how to get estrogen to do what you want it to do and not to do what you don't want it to do. So the things that decrease health and functionality of ER beta receptors are horse estrogen, like Premarin, synthetic progestins, like medroxyprogesterone acetate or birth control, progesterone deficiency, diets low in cruciferous vegetables, diets low in B and E vitamins, low levels of E3, which is estriol, that's a type of estrogen, and vitamin B6 deficiency. So that gives you some things to avoid and think about so as not to damage the superpowers of your ER beta receptors. Things that promote the health of ER beta receptors are whole complex vitamin E. We talked all about this way back in episode 17. Vitamin E is not just one thing. So not the kind of vitamin E that you find at the regular store or pharmacy, DL, alpha, tocopherol, but whole complex vitamin E. Send me a message if you need more info or go back and listen to episode 17. It's super important that you get the right vitamin E, and it helps your estrogen receptor beta. Broccoli and broccoli sprouts are good. Estriol, which is E3, we'll talk more about this in the future, but it's not the kind of estrogen in regular estrogen replacement prescriptions. Healthy levels of testosterone are good for ER beta receptors. Healthy levels of natural progesterone, healthy levels of DHEA, and whole soy foods. I have a lot of reservations about eating soy because the vast majority of soy grown in the US is GMO, and tons of herbicides and pesticides are used in soy production. But if you have a really good source for organic soy, its xenoestrogen effects are actually really good for you because it's good for ER beta. And like we mentioned before, some things that ramp up ER alpha up to unhealthy levels are excess body fat, stress, bad fat in your diet, eating a lot of sugar, low fiber diets, poorly functioning thyroid gland, progesterone deficiency, alcohol, environmental chemicals, vitamin B6 deficiency, and then just genetics. I think those are good to know because if you somehow had a clone of you in an alternate reality, you could both have the exact same estrogen levels running through the exact same body with the exact same genes and the same cellular machinery. But if one of you avoids environmental pollutants and endocrine disruptors, gets enough vitamin B, whole complex vitamin E, eats broccoli and broccoli sprouts, and has healthy levels of estriol, progesterone, testosterone, and DHEA, and the other one is exposed to environmental pollutants, avoids vegetables, doesn't get the right type of nutrients, eats a lot of unhealthy fats and sugar, and has out of balance estrogen types with high estrone levels, low progesterone, low testosterone, and high or low DHEA levels, you will have dramatically different experiences of life and long-term health risks just because of estrogen receptors. The number and health of your estrogen receptors is a huge determinant of how, quote, safe your hormones are. There can be some risks to the presence of sex hormones in your body, both endogenous hormones manufactured by your cells and exogenous hormones that you take as a prescription medication. You have to weigh the risks and benefits and make the right decision for you. But I think it's important to know that you can very much tip the scales of that risk to benefit ratio by the cellular and subcellular environment that you create. The correct numbers and full functionality of estrogen receptors helps your estrogen send the instructions to your cells to maintain bone density, maintain cognitive function, maintain vaginal tissue health, maintain skin health, protect you from cardiovascular disease like heart attacks and strokes, maintain mood and energy levels, and all the other wonderful things that estrogen does for you without hugely increasing your risk for breast, endometrial, and ovarian cancers or blood clots or other scary things that you might have heard about. Whether you choose to take additional hormones or not, having the proper balance and health of estrogen receptors will put more years lived in good health into your future. Thank you so much for taking the time to learn about estrogen receptors today. I'm hereby bestowing on you an honorary degree in estrogen receptor biology. Pair that with knowing about the different types of estrogen and the different types of estrogen metabolites and how you can affect how estrogen is metabolized and disposed of, and you'll deserve a MacArthur Genius Award. Not to make light of geniuses who have actually won those awards, but it is for reals something special that not many people understand. So kudos to you. You are awesome. I mean that with all sincerity. I know you're bound for doing great things for a long time to come, and having the proper balance of estrogen receptors will make accomplishing those things less of a struggle. Next week, we're going to talk about improving our intuition to be able to age better. Until then, do the things that make more and healthier estrogen receptor beta, and don't be normal. Thank you so much for tuning into the Health Courage Collective podcast. I am truly honored that you have paid me the enormous compliment of your time and attention. I would be so grateful if you would share this podcast with someone you know and subscribe so you never miss an episode. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse events by use of information contained herein. If you think you have a medical problem, consult a licensed physician.